my name is Dorothy Immel, and for my final paper for Advanced Abnormal Psychology, I have chosen the mood disorder known as unipolar disorder, or more commonly depression. I chose this particular disorder because it is one that hits very close to home for me. 3 years ago, my husband experienced a massive heart attack and underwent quintuple bypass surgery. Because it took him many months to recover from the physiological aspects of having a vein removed from his leg with a scar from groin to ankle, and his chest literally cracked open, he lost his job. So on top of having over $250,000 in medical bills, he now no longer had any income and lost his home and his car as well. When he fell behind on his child support, he also lost visitation with his then 3-year-old daughter. As one can imagine, he fell into a very deep depression. When he realized that he had become a shut-in and found himself considering suicide, he did reach out to a family member and allowed them to have him admitted to a respite house, where he received both the psychological care that he needed and the support of the staff and other residents of the respite house, with whom he credits his recovery, which I am very glad for, because otherwise I would never have met him. Like my husband, we all experience depression. We go through periods in our lives when everything is just not as it should be, and we let it get us down. Relationships end, jobs do not work out, cars break down, those whom we love pass away, and sometimes just walk away. And yet again, the Rangers fail to win the World Series. For most of us, such setbacks and the blues we experience as a result are temporary conditions. We experience trials and may suffer through them, but we overcome them and move on. The terms we have for such moods are as varied and numerous as the causes behind them. We may consider ourselves blue or downhearted, suffering discontent or in a funk. Regardless of what we call it, even as we sigh and bemoan it, we still know that it is just a phase we are going through, and as soon as we turn our lives around or recover from our loss, we can put it behind us. When one cannot, however, when the malaise lingers longer in spite of our best efforts to overcome, or worse, when we no longer believe we can or will overcome, then we must address the fact that we may be suffering from the unipolar disorder known as depression. Depression is certainly not new to the human condition. Paul referred to it as worldly sorrow in 2 Corinthians. Densmore suggests depression as a separate mental state has been recognized and commented on almost since the beginning of recorded time. What we know today as major depression really came about as more of a definition refinement rather than a discovery of the psychological state itself. Kummer reminds us that the Bible speaks of the severe depressions of Nebuchadnezzar, Saul, and Moses. It was Emil Kraepelin, an early 20th century psychiatrist, who first began to break what was formerly known as melancholy down into what he referred to as depressive states. This was the beginning of the definition refinement to which Ms. Densmore refers. So how do we define depression? Meyer reminds us that joy, contentment, sadness, and despair are all different points on a continuum, points at which any of us may be found at any given moment. Sorrow hollows out the well wherein joy dwells. Or in the words of my favorite poet, Khalil Gibran, your joy is your sorrow unmasked, and the selfsame well from which your laughter rises was oftentimes filled with your tears. When our lows linger, and joy is but a distant memory, that is when we have digressed from the normal cycle of life. Meyer suggests that the difference between a blue mood after bad news and a mood disorder is like the difference between gasping for breath after a hard run and being chronically short of breath. Dr. Myers goes on to advise us that major depressive order occurs when at least 5 signs of depression last 2 or more weeks and are not caused by drugs or a medical condition. According to Wallach and Colby, these symptoms may include, but are certainly not limited to, lack of appetite, prolonged sadness or weepiness, insomnia, irritability or anger, lethargy, difficulty concentrating, constipation, lack of interest in one's appearance, avoiding interaction with friends, family, and society at large, and feelings of loss or helplessness, feeling life is no longer worth living, and thoughts of death or suicide. Causes of depression can be as numerous and varied as the symptoms and definitions. Hippocrates suggested that the etiology of melancholy was an overabundance of black bile in one's system. Though modern diagnostics may have disproved this theory, the Greek physician was not wrong to look for physiological predispositions for this psychological condition. As Myers points out, depression is a whole-body disorder resulting from the interaction of many factors. We now believe that genetics play a strong role in one's susceptibility to depression. This mood disorder can also occur concurrently with other illnesses, leading to investigation as to whether it is yet another symptom of a disease or merely a byproduct of not being well. Likewise, there are medications, such as beta blockers for hypertension, that can also lead to depression. Recent studies have also shown that inefficiencies, or as Kummer suggests, low activity levels of two neurotransmitter chemicals, norepinephrine and serotonin, have been strongly linked to depression. Non-professionals often refer to this as a chemical imbalance, but it is really more of a roadblock or a traffic jam. Major life events, such as my husband's heart attack, can also cause depression. In fact, Wallach and Colby inform us that nearly 1 in 3 heart attack survivors becomes depressed. Physical, sexual, or emotional abuse can lead to depression later in life due to the painful memories and the feelings of helplessness associated with these experiences. Unresolved conflicts with friends, family members, or co-workers may lead to depression. Any event that causes major changes in one's life, even if the event is one to celebrate and the changes are for the better, such as marriage, a new house, or a new job, can lead to depression. Not surprisingly, alcoholism and drug abuse can also lead to depression. This results in a very vicious cycle. These patients may feel that they drink or do drugs to alleviate the depression, not even realizing that they can be deepening and or prolonging it due to the depressive properties of the substances that they choose to abuse. One cannot address causes of depression without also touching upon Beck's triad of negative thinking. Aaron Beck believed that a leading cause of depression was a common three-cycle process of negative thinking. It begins with a negative view of oneself, then progresses to how that view changes the world's view of the individual, and then concludes with how that affects their future. It becomes a self-fulfilling prophecy if the cycle is not broken. Fortunately, there are many effective treatments for depression, including counseling and pharmaceutical therapies, and often a combination of the two. According to Myers, the antidepressants were named for their ability to lift people up from a state of depression, and this was their main use until recently. They work by increasing the availability of norepinephrine or serotonin, those neurotransmitters that elevate arousal and mood and appear scarce during depression. In other words, they tip the scales of the chemical imbalance. Electroconvulsive therapy, or ECT, is also still an effective treatment for those who do not respond to therapies that are more conventional. Electroconvulsive therapy may bring to mind barbarous images thanks to Hollywood's portrayal, but it is a safe and effective therapy as practiced today. In its inception, barbarous may have been an apt description for this treatment. As MayoClinic.com suggests, much of the stigma attached to ECT is based on early treatments in which high doses of electricity were administered without anesthesia, leading to memory loss, fractured bones, and other serious side effects. The results were indisputably beneficial, however, so the techniques have undergone modifications for maximum effectiveness with minimal discomfort or side effects. Today, the patient is under general anesthesia and often receives muscle relaxants as well. They will still convulse, but due to the anesthesia and the muscle relaxants, injuries are reduced if not eliminated. They also receive a lower voltage, and it's administered in pulses rather than a steady current. Myers reports that after 3 such sessions each week for 2 to 4 weeks, 80% or more of people receiving ECT improve markedly. He goes on to advise that the study after study has confirmed that ECT is an effective treatment for severe depression in patients who have not responded to drug therapy. Regardless of other therapies employed, individuals suffering from depression should also undergo counseling therapy. Counseling will help patients to determine the causes of their depression, recognize the symptoms should they return after a successful course of antidepressants or other treatment, and learn new strategies to cope with such concerns before they can escalate to the level of suicide or societal withdrawal. Each psychological theory will, of course, approach counseling in a different manner. Cognitive therapists believe our patterns of thinking strongly influence how we feel and behave. This form of therapy, therefore, will often focus on changing the negative ways in which one suffering depression looks at themselves and their lives, as described in Beck's triad of negative thinking. As Myers suggests, we often think in words. Therefore, getting people to change what they say to and about themselves is an effective way to change their thinking. A behavioral view, on the other hand, is more likely to focus upon how individuals reward or punish themselves, i.e., positive and negative feedback. Consequently, therapy may consist of teaching patients a new internal response to stimuli that would ordinarily bring them down. Relaxation techniques are often taught and then attached to the negative stimuli, so that the negative catalyst results in the practice of relaxing rather than spiraling downward. For example, this author has conditioned herself to say the Lord's Prayer whenever she experiences a stressful reaction to external stimuli. So ingrained has this technique become that there are times when she does not even realize something or someone, very often my mother, has caused a stress reaction until she realizes she is already halfway through her mantra. This is an example of a positive feedback loop. Classic psychoanalysis, on the other hand, believes that internal conflicts are responsible for most psychological concerns. This approach, therefore, would involve ascertaining what the causative conflict might be and then working through it in order to overcome it and move forward, free of depression. The biopsychosocial model integrates biological, psychological, and sociological causation and treatment. It is in this model that we may find the greatest ease in incorporating our Christian worldview into our psychological practice, as our faith is very much a part of our sociologic realm. As Jones and Buttman contend, within the context of this model, religion is often treated as a social factor, and spirituality is understood as a psychological process. Integrating faith into our treatment regimen allows us to utilize prayer and scripture as part of the therapeutic process, as well as calling upon our faith community for uplifting support when feeling discouraged. Psalm 28:7, "The Lord is my strength and my shield. My heart trusts in him, and he helps me. My heart leaps for joy, and with my song I praise him." Cannot help but uplift a troubled soul. We all feel discouraged at times, especially when life just brings us down. Most of us can endure our trials, however, knowing that they are temporary. The flowers will bloom again in spring, and spring training gives us renewed hope of a World Series victory. When our lows persist, however, we need to consider that we may be suffering from depression and seek appropriate care. There are many effective treatments available, and recovery is often attained through a combination of those techniques. We must also remember that no matter how alone we feel, we never truly are. Not only do we all have friends, family, and community to assist and support us if we allow them, healing is seldom more than a prayer away if we but ask.